It is Sunday, March 20, the International Day of Happiness. Hello, Jamaica, I'm Kerry. Congratulations, you've begun the happiness mission right. And all you had to do was set the channel to Jamaica Magazine. Go ahead and smile.
And another thing, you can say that I'm a dreamer and you think it's uncool. Preaching about the better life I learned in school. Across Jamaica
for righteousness.
Let's join hands.
Let's join hands across Jamaica
For righteousness.
Oh, eternal Father.
Bless this Jamaica land.
Let's join hands
And hearts together
and make Jamaica
a land of love. Smile and everything will be fine. You don't know all the vibe kicking me inside.
You know what makes me happy? Well, actually, that list is rather long. But as a true islander, going to the beach is definitely on it. If you're like me, you'll be happy to see what government has been doing to make the beach experience a nicer one for all Jamaicans. Sand, sea, sun. Taking a swim in the Caribbean Sea is a well-known joy for visitors to our fair isle, as it is for locals. So access to quality public beaches is being expanded so more locals can enjoy the natural attractions.
There are few beaches around Jamaica with these amenities that are free for the general public.
The Tourism Enhancement Fund, TEF, is implementing a project called the National Beach Development Program. The fund is spending $250 million to transform at least 2 beaches per parish into quality recreational spaces for residents and visitors. The effort is being supported by the Natural Resources Conservation Authority, NRCA. Each beach was assessed before renovation plans were drafted in conjunction with local authorities. The beach development program is also being implemented with support of the Urban Development Corporation, Social Development Commission, and the National Environment and Planning Agency. The upgraded facilities come with children's play areas, table eating and picnic areas, gazebos, restrooms, changing room facilities, parking, lifeguard towers, and utilities such as water and electricity. Entry will either be free or at a minimal cost, charged for the use of facilities such as bathrooms and concession areas. 2 beaches have already been renovated and handed over to their respective parish councils. The Burwood Beach in Trelawney was upgraded at a value of $28 million.
This beach, where the community of Retreat, Heights and Cobalt spend use on a regular basis, and really and truly, if you see on a public holiday, it is for the entire Jamaica.
The famous Portland Beach was refurbished at a cost of $27.7 million.
This is a place to be in this most beautiful parish.
As residents enjoy these 2 facilities, contracts for the renovation of 2 other beaches have already been signed. One provides $30.5 million to upgrade the licensed beach in St. Thomas. The other earmarks $28.1 million for refurbishing the Marking Stone Beach in St. Mary. So by the summer of 2016, residents near License and Marking Stone should be able to make splashes, as work at those beaches are scheduled to be completed by then. Other beaches identified for upgrading include Salem Beach in St. Anne, also known as the Runaway Bay Beach. In St. Elizabeth, the 2 beaches have been selected, Great Bay and Fort Charles. The Old Harbour Bay Beach in St. Catherine will also be refurbished. It's a popular spot for children and offers up a source of earning for dozens of residents. Over by the West End in Westmoreland, the Norman Manley Park Beach was selected for upgrading. Also on the agenda, the Jacob Taylor Beach in Trelawney, Orchard in Hanover, Dump Up Beach in St. James, and Lime Key in St. Andrew. The Ministry of Tourism, through the Tourism Enhancement Fund, ensuring that Jamaicans have access to the best public beaches equipped with world-class facilities.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Protect yourself from the bite of this mosquito. A message from the Ministry of Health.
So, what could a discussion about mosquito-borne diseases and influenza have to do with my happiness? I'm glad you asked. The United Nations actually recognizes good health and well-being as one of the building blocks for a life of happiness. That's why we've invited the country's chief medical officer to tell us what government is doing to deal with some of the threats to public health and, by extension, our happiness. It's time for Issues and Answers.
Thanks for joining us for Issues and Answers. I'm Ian Boyne. Today we have with us the Chief Medical Officer, Dr. Winston Delahaye. We're going to be talking about the efforts to deal with H1N1 as well as the ZIKV. This is an area that a lot of us have to be interested in. We are heavily invested in this, and we, as usual, try to give you the information that is useful. We thank you for your company. Dr. Delahaye, good to have you on set.
Thanks for having me. Yeah.
What's the latest in terms of the government's efforts in dealing with H1N1 and ZIKV?
Well,
where are we?
On February 15th, we recognized that we're getting, but then we're at 5 reports, confirmed reports of H1N1. Recognize that this was an increased number given the time of year, and adjusted our reporting structure to moving all SARS is the term we use, severe acute respiratory infections, to being class 1 reportable, meaning we want to know within 24 hours as opposed to where it was before, class 2, you had a week to report to the Ministry of Health. But more importantly, to the first point of contact to send off a sample for testing. And then we also sent out what we call a case report to remind physicians of what we're looking for and who would be a suspect case. So they don't need to be confirmed. If you suspect, we want to know within 24 hours. So
all the physicians had that communication from the ministry?
Absolutely, absolutely. And we disseminated through our own email groupings, and in addition, the Medical Doctors Association, the Medical Association of Jamaica. And so having done that, we then called all senior medical officers for all hospitals to ensure they identified isolation areas. And so you can well imagine this is way before any large numbers were coming in, but public health is of that nature, you must be prepared. So we alerted them to identify areas and start making these available, because we're moving the H1N1 specifically, severe respiratory infections, to high alert based on the results we're getting back. In addition to that, we also looked at what we have available in terms of stocks. We recognize the need to beef up our supply of the flu vaccines, for example, and that's February 15th. Again, despite the challenges, we were able to move early and to ensure that we ordered 5,000 vaccines in total through PAHO as well as through our colleagues in Trinidad. And that would have been
adequate?
Well, so what we have now was based on the usage last year.
Yes.
And so that's how we budget for the following year. We have not a good history culturally in this country in terms of people accepting flu vaccines. In fact, last year we had to toss out 1,000 vaccines. That's just how it's been. I know of a number of family physicians who in the past have ordered vaccines, have had difficulty with uptake is the term we use, and you have to toss it out. They have a shelf life, they last a year, they make them for a year at a time. So we recognize the need, having had based on last year, 3,500 and 400 for pediatric uses, based on last year's report, that we needed more. So we got more in to cover at least our frontline healthcare workers. We're now making a thrust come the new flu season, because we're near the end of this flu season, to have persons get more serious about getting their vaccines. It's usually done in about September, October in North America, but we need to start that here. So we're looking at procuring with the new minister. He has advised us to look at making this available in all pharmacies and at an affordable price. So we're looking at
it's a change in policy?
It's a change in policy. It's a change in policy.
Change in policy now. Explain that change in policy.
So,
what existed before and what exists.
It's on two fronts. So having had this experience as it relates to vaccines, we recognize the need to now not only order more to cover all healthcare workers, because at this time we're covering our frontline staff, meaning those who would be in contact with persons coming in, emergency rooms, clinics, casualty areas. We recognize the need to cover all healthcare workers and to ensure that it's available, the flu vaccine that is, to persons in high-risk groups. And that would include the elderly, persons, women who are pregnant, children, and those with chronic illnesses like asthma, high blood pressure, diabetes. So we really want to ensure persons get more serious about protecting themselves, because that's a preventive measure. Yes, you do get some symptoms when you get the vaccine, but comparing flu illness with the symptoms from the vaccine, it's chalk to cheese, as I say in Jamaica. So that's on the one front. On the other, and this has been a major shift in policy. Only today, as we speak, that Tamiflu before now was only brought in by the Ministry of Health. When we met on the 15th, recognized the need to have more available, we wrote to the pharmaceutical importer, the pharmaceutical house dealing with...
was that the 15th of February?
15th of February. Wrote to them advising them that they're allowed to bring in more and also to stock hospital pharmacies. So in addition to the Ministry of Health having this available, and by then persons started to use it, there were patients who needed it. We asked them to bring in more to have it available in hospital pharmacies so that consultants would be able to prescribe this, meaning it would go to patients in need. It's not every patient who would need Tamiflu. We wanted the more severe ones to. Having seen the figures move, which we'll soon come to, we then made a further adjustment, and this is with the advent of the new minister coming in. So it's many things in a short time. To now having Tamiflu, subject of course to the importation by the pharmaceutical distributors, available in all pharmacies. Of course, you would need to have a prescription by a physician. And in the same breath, sending out the information to physicians around the country as to who we recommend should get Tamiflu. So we really don't want it to be everyone, or soon you'll have resistance being developed towards the product, you know. There are persons questioning the use of Tamiflu in preventing, for example, you know. So we think we want to really encourage the high-risk persons. If you are asthmatic and you come in with a flu, your physician now doesn't need to send you to a hospital in order to get it, which is how it was until today. But you're now able to write a prescription, and of course we expect that the pharmaceutical distributors will be bringing in more to make it more available. It's how it is in the Cayman Islands, in the US and in Canada. So we're moving as the need arises.
It's a major shift in
policy. Twice in a month we've made an adjustment because the need has suggested, you know, that we must make some changes.
So the government is moving aggressively to deal with the matter of disease control, the matter of battling H1N1 as well as Zika. The Chief Medical Officer, Dr. Winston Delahaye, is here with us. We take a break, but we'll be right back.
Don't make diseases spread. Wash your hands with soap and water instead. Wash them regular or use a hand sanitizer. Make sure the germs them dead. Touching your eyes or your mouth or your nose. Wash your hands before you do things like those. After you use the bathroom before preparing food, come on, wash your hand them clean.
Chief Medical Officer Dr. Winston Delahaye is our guest on Issues and Answers. Dr. Delahaye, you were delineating the various efforts to deal with our health challenges.
Yes. So in addition to that, the increased surveillance. So surveillance as it relates to identifying persons who would be suspected of having the infection and having samples sent off. So what would normally obtain with the flus would be that every 10th person we have what we call sentinel sites, about 77 of them around the country, sentinel sites. So these are different health centers, hospitals, who on a normal circumstances, they would take every 10th person, a sample from every 10th person coming in with the flu. Having ratcheted up the preparation and our response to the issue, we now have every single person with a severe acute respiratory infection having a sample sent off. And in fact, we have influenza sentinel sites in 7 major regional hospitals in the country. And this information is provided to the CDC in the US, which assists them in determining what's around internationally, and more importantly, in preparing the vaccines for the next flu season, because they are prepared based on the pathogens from last year. So this year's pathogens will determine what the makeup of the vaccines will be for September, October onwards. In addition to that, there are the increased vector control activities. So we identify what we call high index areas. So the Aedes aegypti index, which is a mosquito, we're moving now from H1N1, which is a droplet-mediated infection, to the ZIKV, CHIKV, and that's mediated by the Aedes aegypti in terms of vector. And the index is the number of houses with breeding sites when you do your surveillance of every 100 homes. The WHO recommends that if you keep that figure at between 5 and 10%, it's unlikely you'll have a major transmission of any infection in a serious way in any country. Well, when we do our surveillance, there are places with indices of 40, 50, meaning 1 in every 2 homes you found breeding sites. So we had to ratchet that up. And so we increased our fogging in these areas especially, in addition to the routine fogging being done in all areas within the country. But in these high index areas, we increased the fogging. We then, throughout the surveillance, noted that whereas the indices went down having fogged, because fogging only kills 30% of adult Aedes aegypti mosquitoes. So we needed to get out to the public that it is the breeding sites that we need to destroy to not have more adults coming. You can't depend on fogging alone. In other words, this is far more than a Ministry of Health issue. It's about you and your home, your environs. And so we noted that where the numbers went down initially, within a week or 2, they went back up, the indices. And hence the launch of an Operation Mosquito Search and Destroy. By then I was on board, February 1st. So we started Operation Mosquito Search and Destroy, starting in a high index area in Portmore and an area in St. Catherine, Spanish Town, and then moved to Ocho Rios last weekend. And our next move for the 2nd of April will be in Mandeville, going out in and around the homes of persons to show them what we're talking about. So there's a one home we went into where it was clear that they made every effort to clean up, beautiful, nice and clean. There was one butter pan on our table, filled with thousands of larvae. And so it must be that you know what you're looking for and you turn over these things, punch holes in them, cover drums. These are, some of the major issues that we find. And we just haven't had that mindset. This isn't just about now we want to change behavior. As you know, I'm a psychiatrist. Right. It's not the easiest thing to do. Yes. So we have decided to leave our air-conditioned offices, go out on the ground with the people to show them, brethren, this is the plan we want you to turn over, so they understand. And we think the efforts are,
and it's just fruitful. Not a matter of getting rid of dirty water.
It isn't dirty water. So this is still clean water in and around your home, in pots, that you'll be watering your plants with. Little puddles around, even in some of these, bromelias, these plants which would be able to trap water in there. And so in and around your tray,
you're not saying we
can
water plants, though?
Water them, but remove that tray which prevents the water, it keeps some water there so the plant can have it to absorb. You might not want to have that in place now. You want to have the water run off and so on. The trays on the refrigerator may be hard to get to, but put a little oil on top of a little film on top of the water. Toilets not used. If you notice, you have a few toilets in your home, one of them which is least used, you lift up, you'll see larvae. And so we really are saying nowhere is out of bounds. In and around your sink, a couple of drops of water is enough for the larvae to breed. And so we want persons to recognize, to understand that, for example, the eggs of these mosquitoes can live up to a year until they get water, then they hatch. And so, we're making every effort, really going overboard to get our citizens involved and to understand it's about me and my environment and protecting myself.
And we had a power team here just last week.
High power team from PAHO came in, looking at our facilities, and PAHO has been a significant collaborator in this. We, as you know, have upgraded our virology lab at the University Hospital of the West Indies, which is where the National Influenza Center is, a MOH collaborative effort with the University Hospital. And PAHO provided the training. They've been instrumental in providing reagents, and these aren't inexpensive products, you know, so they've been very helpful. And as a result of that, and of course through the Chase Fund, NHF, we've been able to, in the tune of $10 million, provide an upgrade in equipment. The University Hospital now does the testing for ZIKV.
We're doing our testing.
We're doing our own testing. To date, I'm aware of at least 30 samples sent within the first week of opening. And so what will happen is the backlog we've been facing with those sent to CARFA, because CARFA in Trinidad does all the testing for the English-speaking Caribbean. And so with their best efforts, we still have a backlog of over 100 samples waiting on since January and now. That's what will stop with the advent of the testing at the University Hospital, that if we're sending 20, they do 20, if we send 50, they do 50. So that backlog will no longer be on.
Thank you very much, Dr. Winston Delahaye, Chief Medical Officer. Very useful information, critical information about change in government policy, which makes it easier, more effective to fight the diseases that Jamaica is fighting at this time. Stay tuned to us here on Issues and Answers. We give you the information that is useful to you. Next week I'll be back. Until then, Ian Bourne wishing you a pleasant day.
Smile, and everything will be fine. You don't know all the vibe, kicking me inside.
We're still celebrating the International Day of Happiness, and our next feature explores the impact of one particular artistic expression. And right after, Jamaicans tell us what makes them happy.
You have to actually listen to other persons while you're playing, while as focused on what you're doing.
This is the cello. It's the middle of the string instrument. The strings are easy to remember and it's easy to play. I'm not wonderfully great in it, but I know that I can do something.
Anytime I'm having a bad day, I just turn on my radio, listen to my songs, or play my violin. And it kind of calms down everything.
3 promising young persons sharing one goal. They are among many others seeking to take full advantage of the offerings of the National Youth Orchestra of Jamaica. Lying at its core, classical music and its transformational powers.
If the music is quiet and calming, it actually can lower our blood pressure. If the music is fast, then it can actually increase our heartbeat, and it also affects our brain waves because the brain has different frequencies of brain waves according to how active we are. So the music gets in sync with the brain waves, so it can actually affect our brains.
Here's a simple question. Would you exercise with slow-paced music in the background? Or even try to fall asleep while listening to hardcore dancehall, for example? That's right. Without us even thinking about it, music has a big part to play in how we do things. The effects of music on individuals are far-reaching. It has the potential to affect the physical, intellectual, emotional, psychological, spiritual, and social aspects of our lives.
I'm from Maxfield Avenue. Living in such area, you know, lots of violence and stuff. When I want to escape, I think of my cello and just think of the music, that it just imagine that I'm playing it and just escape and go to that special place.
Music by itself has many positives, but for those who are part of musical groups, there are added benefits too.
It has a lot of discipline.
You will have to interact with all of your partners. You will have to learn to listen to each other. So that way you will improve your personal relationships with everyone else.
It teaches you how to act as a team, so it gives you critical problem-solving skills.
While it's a fact that soft, soothing music works wonders, the experts are not denying there is a place for loud, pulsating music, but they suggest everything in moderation.
It helps sometimes to get rid of frustration, and sometimes that really is necessary. But we can't have it all the time, because anything you pay attention to manifests.
So with all the benefits outlined, it may be worth more than its weight in gold to slow down, pay attention, and change the beat. On July 12, 2012, the United Nations General Assembly adopted Resolution 66281. It proclaimed March 20 each year as the International Day of Happiness. The International Day of Happiness recognizes the relevance of happiness and well-being as universal goals and aspirations in the lives of human beings around the world.
And all that you do will come back to you. Life, it ain't easy.
It might seem crazy what I'm about to say.
Being alive makes me happy.
Go to church on Sundays and come home and relax.
Having Jesus as my Lord and personal Savior makes me happy.
Getting closer with Jesus and getting some money.
What makes me happy is having family and friends close to me. That's what makes me happy.
Clap along if you feel like a room without a roof, because I'm happy. Clap along if you feel like
seeing other people happy.
Music makes me happy because sound I play Richard sound in the hymns. So music.
Music makes me happy. I love music a lot. I love wine and dance.
What made me happy? My mother and my 2 kids. Okay? That's what made me happy.
My family made me happy and school made me also happy because without school, you know education. So you have to have education to be happy. Yeah.
What make me happy now to see my son go to school, see up and better, you see it? So that makes me happy still. So I'm just going to make sure that him happy, so me can happy too.
People love you when you smile and hate you when you screw. Lots of happiness, Rasta know we are wishing you. You could have come from Jamaica or on a low. Hey, keep a smile on your face and see the good that you do. When I say up a door, smile and everything will be fine. You don't know all the vibe kicking me inside. Love it when you smile, you look beautiful like that. Mugging from top, your dimples are so cute. A lot of happiness in smile.
Before we go, think on this. Plenty of people miss their share of happiness, not because they never found it, but because they didn't stop to enjoy it. Embrace and enjoy the things that make you happy and the people. For more information on government's response to Zika and H1N1, visit our webpage, jis.gov.jm. We're also on YouTube, Twitter, Instagram, and Facebook, so log on and stay in the know. Until next time, I'm Carrie Ann Smith. Have a happy day.
This has been a production of the Jamaica Information Service, the voice of Jamaica.